Optibond XTR dental adhesive is as effective as a total etch bonding agent while encompassing the simplicity of a self-etch bonding agent. A truly universal bonding agent, Optibond XTR delivers predictable outcomes for every clinical procedure, bonds to all restorative substrates, and is compatible with any resin cement, without the use of phosphoric acid, silane, desensitizer, or dual cure activator. One-bottle self-etch bonding agents are mildly acidic and do not effectively etch the enamel, requiring selective etching using phosphoric acid. Two bottles provide optimum chemistry, allowing for a better etching primer and lower pH. The patented three-solvent system, along with the GPDM adhesive monomer in Optibond XTR, is able to achieve a better etch pattern than other self-etch adhesives for better bond strength, durability, and less marginal failure. Therefore, phosphoric acid etching of the enamel is no longer needed to achieve good bond strength. The unique chemistry of the enhanced self-etch primer and optimized adhesive in XTR brings outstanding bond strengths to cut and uncut enamel and dentin. Single bottle systems try to be both hydrophilic and hydrophobic at the same time, and therefore do not etch or penetrate as well. XTR's two-bottle system is more effective with its hydrophilic acidic primer and its hydrophobic adhesive. With direct and indirect restorations, post-operative sensitivity is a common, troublesome event. XTR's two-bottle chemistry allows the bonding agent to better etch, penetrate, and seal the tooth. The unique solvent blend, along with the GPDM adhesive monomer, enables better penetration of the dentinal tubules and ensures a better hybrid layer formation to protect against sensitivity. Optibond XTR is the self-etch, light-cure, universal dental adhesive designed to deliver unmatched power and reliability for all direct or indirect restorations while eliminating the need for multiple bonding agents, phosphoric acid, or ancillary products.